Turning now to health. As the third year of this pandemic begins, the slogan, "Follow the science," it has become politicized like so much else. Doctors and scientists find themselves trying to treat COVID while navigating an onslaught of misinformation. And joining us now to talk about the challenges facing the medical community is Dr. Michael Turner, a board-certified physician specializing in integrative medicine. Doctor, good morning. Thank you for joining us.
Thank you, Giselle. Glad to be here. Good morning.
Oh, so happy to have you here to clear up some stuff for us. But first, how challenging is it to treat patients in an era of COVID-19, just stunning misinformation?
Quite challenging, Giselle. We are all putting forth our best effort. I believe in giving people the benefit of the doubt and believe that people are acting with integrity, with good intentions to help our community. The challenge is not only the information that's out there, but frankly, in our best efforts, in many cases, we are not allowed to progress more towards the cutting edge or to stay up with the science as far as what would be helpful, lest we ourselves be accused of promoting misinformation. That's actually the problem. I believe the current overriding interest in preventing misinformation is actually squelching good patient care and preventing some doctors from doing their best in being aggressive in helping people.
Yeah, do you think that cancel culture in particular in the medical community is hampering scientific research and the processes you have to go through to bring us the truth?
Absolutely, I do. And I'm sorry to say that. As you said, good science requires questioning, it requires dissent, it requires acknowledging alternative viewpoints. If we want to follow the science towards better patient care, we have to have good science to follow. But that only occurs in a context of dialogue, of questioning, of dissent, sometimes even aggressive interpretation of data. But that's okay. If we stop doing that and we silence voices that are not at present considered mainstream, and we just draw a circle and a line and say, this is what constitutes good COVID information and nothing else, and we will silence anyone else who's outside of this circle, at that point, we don't have scientific progress. We have institutional dogma, and that will not result in good patient care.
Yeah, it's hard to keep the politics out of it. What are your thoughts on this proposed bill in California that would make it easier for the state's medical board to discipline doctors who promote misinformation?
Overall, I would say I'm not a fan. I don't think it's necessary. There are already established medical boards in every state to deal with potential questions of impropriety. Those boards are already legally enabled to act. So we already have a process. To make it a political process and to put it in a bill here, in my mind, is overkill and opens up the whole process to, frankly, political influence. Let doctors be doctors. Let doctors, as a jury of their peers, decide who's practicing appropriately and not, and let them sort it out within traditional medical board settings.
So you don't think that these comments that promote misinformation should be censored for the safety of the public?
Well, let's just ask the question, what is information and what is not? Who gets to decide that, right? If someone is providing information that is frankly false and has no scientific support and is outside of their expertise, for example, a quack or someone who's self-promoting on the internet, some kind of snake oil cure for COVID, sure, that person by all means should likely be discouraged or perhaps censored from promoting their views. On the other hand, when you have physicians, when you have scientists, when you have PhDs in their area of expertise and knowledge, raising questions or trying to advance the dialogue a little bit beyond what is currently accepted, and that's labeled misinformation, I find it problematic, especially as regards social media companies. Who's labeling what is information, what is not? Some executive at Twitter? What do they know about biochemistry? What do they know about mRNA vaccine technology? What do they know about biostatistics or interpreting data?
It's very, very challenging for sure. And before I let you go, we only have 45 seconds left. But with LA County marking over 30,000 COVID-19 deaths, how do we know who to trust?
A great question. I think the answer is to begin with your own doctors whom you have a trusting relationship with. In many cases, they know you the best, and to progress from there. But there are also organizations outside the mainstream that are very trustworthy. I would recommend FLCCC as an example. This is a group of doctors who have been publishing protocols about how to treat COVID since the very beginning. They now have an international reach, and they publish a variety of good information.
That's a really good source. Thank you so much. For more about Dr. Turner, visit him online at michaelturnermd.com. Thank you so much for joining us. And we will be back, everyone. This is Your Morning on Spectrum News 1.